I'm here with Monali and Kayla from the University of South California, two students from a global health program looking at first time, I think, the World Health Assembly and the relevance for your studies and for your experiences. Can you share your experience from the World Health Assembly?
Yeah, so this week my topic was on maternal mortality, and I was really interested in understanding how different countries are addressing like what's going on in their community level and the strategies they're implementing. And every country has given something different and they've seen results. So it's good to hear that they're listening to what the community needs. And I've seen, like, for example, I was actually talking to Molly today about it, that in Sierra Leone, they're tracking the women like from like the moment they found out they're pregnant till delivery, and they've seen in the past a change from last year, a 60% reduction in maternal mortality, because they're asking about the comorbidities, what do you need, and they're trying to put parents, and even though they may not have kids yet and they're pre-families, they want them to be on the conversation so they can be proactive about addressing their needs and making sure that they have better maternal outcomes.
This week, I learned a lot about the integration of AI into the traditional healthcare systems and how there are a lot of gaps in our traditional healthcare systems. So how can we make sure when we're using data and AI in a more advanced technological sense, how can we make sure that we do not include those biases or extenuate those circumstances in different countries on a global scale? So there was a lot of talk of how technology and AI advancements are very exciting, but we have to make sure we take time on the negotiation and data privacy and make sure all parties are aware of what's going on before that implementation.
What kind of human rights concerns and ideas did you pick up during the conversations?
Yeah.
So today I spoke to a representative from India who was telling me about their third trimester challenges, and I was asking her more about that, and she said, of course, like in India, if there are like any abnormalities with the infant, then they could be considered for abortion, but
Sex selection abortion, yeah?
Yeah.
It was, exactly.
Yes, and so then she mentioned that the tricky part is that there is no standardization in like what really qualifies, one woman as a candidate for abortion versus another. And so she said it's really like a day-to-day thing. You come, show up, if the judge is not feeling it that day and, may not have the right information, then she may not get the access to the care that she needs and may have to seek out from another, not legal, method, and that's not safe. And it's a shame that women don't have as much of a say in their own health choices, and it's up to another board to come up with what choices they have the freedom to make. Yeah.
For me, I would say the fact that data is not a physical thing, such like an iPhone. I give you my phone and I know that you'll give it back to me and all my information's on that phone. But with data, you can share it with someone, but you don't necessarily know where it's going. So that's a huge concern and kind of a new area that we need to work on, and ensuring that once that data is shared, we know where it's going and make sure it's not used for some manipulative circumstance.
Thank you so much.
Yeah.
Thank you.
Thank you.